The Atlanta-based CDC's vaccine advisory panel says it will be holding a meeting tomorrow to talk about recommendations on offering vaccine booster shots to some immunocompromised people. And there are certainly a lot of questions about a possible third dose. So let's bring in an expert. Dr. Danny Branstetter is an infectious disease specialist for Wellstar Health System. Doctor, thanks so much for being here. And let's start off with by defining who is immunocompromised.
Yes, certainly. These are people who've received a transplant, people who may have a malignancy, either a solid tumor or a blood-based malignancy, a cancer, people living with HIV. And then there's certain people who have medications that treat long-term illnesses. See a lot of them advertised that help suppress immune responses and predispose us to having more complications from infections.
All right, so I actually fall into that category. And like a lot of immunocompromised people, I went out as soon as I was able to get the vaccine, and I got it because I knew that I was at a higher risk than other people. So for those of us who fall into the category, let's say we got our vaccine dose, our full vaccine dose months ago, what is the timing for getting a booster shot? What are we going to hear, do you think?
Yeah, so I certainly think that they're going to recommend those who've been vaccinated for a few weeks to a few months that we're going to see them to recommend this third booster. The exact timing from that second shot, we'll learn more on Friday if it's approved. But that is what we're looking at. But the important thing is that you will need the first two before you get your third booster.
All right, and let's talk about the rest of the population as far as booster shots for people who are not immunocompromised. What do you think we're going to hear as far as recommendations for that group?
I think what we're going to see is a staged approach to the booster. And I think eventually there's going to be a recommendation that we all, immunocompromised or not, get a third booster. That's what the data is leading us toward. And certainly there's ongoing trials looking at vaccine response for that third booster.
Are you worried, given that there is still so much vaccine hesitancy, that now telling people they have to get a third shot, telling people who haven't gotten any shots that now there's a booster, that is going to somehow contribute to even more hesitancy?
I certainly think it'll add to the COVID fatigue that we have out there. And certainly it's not going to be most well received, particularly those who are a little bit reluctant to get vaccines in the first place.
Dr. Danny Branstetter with important information. He's an infectious disease specialist for Wellstar Health Systems. Doctor, thank you so much.